and excited to share with you some rich content and engage in some hopefully stimulating, valuable discussion. Jasmine, would you please share your slides? Okay, so as I said, today's session is going to focus on veteran oral health. My name is Stacy Chazen, and I am the Leadership and Education Lead at AIDPH, and it's my pleasure to once again welcome you as the facilitator of this month's ECHO call. Next slide, please. Before we get started, we'd like to thank and acknowledge our ECHO partners, CareQuest Institute for Oral Health, the Oral Health Progress and Equity Network, UNLV, and NRHA. Thank you all for your support. Next slide. So our agenda for today's call is we are going to go over some housekeeping items. We're going to have a didactic presentation, as we always do to start, supporting the oral health and well-being of rural veterans. We're then going to go into a case presentation focused on increasing dental provider participation in Maine's Wabanaki veteran communities to take a closer look and a deeper dive at this issue, and then we'll have discussion. Next slide, please. As I shared at the start, today's call is being recorded. We are going to ask everyone to type their email address and organization name in the chat so that we can keep track of who is here today. All materials that are shared on today's call, including the slides and the recording, will be available following today's call on the AIDPH website. We are offering a reminder to please avoid the use of any PHI or PII on this ECHO session. And if you have any questions about Zoom during the during the call, please put them in the chat. And you can actually send those to me or rather than Annalise, since Annalise is going to be one of our presenters today. Next slide. Many of you have been here before, so I'm not going to read the slide to you. I encourage you to visit AIDPH's website to learn more about the organization, its priorities, and its many incredible offerings. Next slide. So for those who haven't been here before, here's an overview of the AIDPH Rural Oral Health Echo series. And this is the 10th offering in that series. It follows the CareQuest Institute's 3 domains framework using the lens of rurality and health equity, teleprevention, minimally invasive care, and integrated and personalized care. And the idea here is that participants take the learnings that they gain from these calls back to their communities to implement in order to build the capacity of the oral health workforce. Next slide. We have covered, this is our 10th topic. This is a reminder of all the topics we've covered in 2022. And the recordings and slides from each and every one of these calls are available on the AIDPH website as well. So if you missed any, we encourage you to take a look. Next slide. Our session norms, we're going to keep up here real briefly. A few that I want to emphasize are that everyone uses first names to facilitate equality in the discussion. If you speak, we ask that you always introduce yourself, including your name, organization, and location. Please keep your video on throughout the call if possible. As we've all been living in this Zoom world for a few years now, I suspect you'd all agree that when our cameras are on, we all feel more connected and the conversation is richer and it's a more enjoyable experience for everyone. So if you're able to do that, please do, but do keep yourself on mute until you're ready to talk. Next slide. So to get us started, we are going to turn to our didactic presenters today, who I'm going to introduce to you briefly. Dr. Annalise Cothran is the co-founder and executive director of AIDPH. She received her Doctor of Health Sciences from A.T. Still University in Leadership and Organizational Behavior, and a Master of Science specializing in experimental psychology with a theme in applied statistics. She's credentialed as a certified in public health and has a certificate in nonprofit management and fundraising as well. And then we're also going to be hearing from Chelsea Chokas, who is a United States Navy veteran and program specialist with CareQuest Institute for Oral Health. With her experience and knowledge of the military and VA health systems, she co-leads the Veteran Oral Health Initiative with AIDPH. Chelsea earned a bachelor's in healthcare administration and a master of science in management from the University of North Florida, Jacksonville. I'm going to turn it over to Annalise and Chelsea now with one last plea as, or I guess this is my first ask of you. If you have any questions that come up during their presentation, please pop them in the chat and we'll get to them when they're completed with their formal remarks. Annalise and Chelsea, please take it over.
Thanks so much, Stacy. We are very excited to be here today on behalf of both AIDPH and CareQuest to share a very recently launched publication. I think we released it yesterday on rural veterans, and we're really thrilled to be able to share some highlights of this report, recognizing we're not going to be able to get into full detail, and there's much more in the full report, which will be linked in the chat whenever we kind of bring that up. But we're excited to be able to talk about rural veterans with this ECHO community as a special end of year cap to this year's Rural Oral Health ECHO program. Next slide, please. Chelsea and I will be presenting. We have no financial disclosures. So I also just wanted to take a minute to talk about kind of how we got here. AIDPH and CareQuest began our partnership at the beginning of last year to focus on veterans. And we quickly realized from the available information and the universe of available data, there really wasn't a lot to work from. So we have taken a pretty dedicated effort over the past couple of years now to research veteran oral health, to build the evidence base of a veteran oral health, and then use that research to improve access to care, quality of care through advocacy efforts. So we're really excited to continue this partnership. It's been incredibly fruitful, and we've been able to really build a network of veteran oral health advocates along the way. Next slide. Some of our previous activities that we wanted to highlight, because it is connected to the broader veteran oral health space. About this time last year, we released our first white paper, which was kind of a foundational review of the current landscape of veteran oral health. And then we followed that up earlier this year, partnering together for our colloquium on transforming veteran oral health that really built out some of the insights and recommendations from that white paper. In April of this year, we put together a visual report and launched that on veteran dental care and how it can stimulate and improve the economy and how it can improve overall health for veterans. So we encourage you to check out those resources too. And so now we'd like to focus on the current report that we released yesterday on rural veterans. This is based on, I'm sorry, go to the next slide, please. Thank you. This is from a collaboration between both AIDPH and CareQuest, and then also with our partners, the Veterans of Foreign Wars and NRHA. So we appreciate their contribution in helping frame this paper. So to give a little bit of background about why we're focusing on rural veterans, not only is this part of our larger overall plan, but as I mentioned when we were looking at research last year, we recognized that veterans are actually disproportionately concentrated in rural areas. And so it's an incredibly timely and necessary focus of our research is to understand what the current landscape of oral health looks like for rural veterans. Giving a little bit of background here, there are almost 5 million veterans living in rural areas. And this is not an obsolete or small focus. In fact, the VA actually has an entire office of rural health, and they have offices located throughout the United States. And so we want to point out that there's a resource there from the VA concentrating on the health and well-being of rural veterans. However, there really isn't a concentration on the dental health of rural veterans. And so we recognized there was an opportunity for us to look at this particular population, knowing too that rural communities across the board experience poorer oral health outcomes. And so we wanted to understand what that looked like specifically for rural veterans. Next slide. So the data that my colleague Chelsea will be presenting in just a moment to give some background about that data. These are responses from a survey that we disseminated last year in partnership with veteran service organizations that we have now been working with since that time, so about a year and a half. This was a survey that was distributed to veterans in the summer and fall of 2021, and we got just over 2,000 respondents. It was a 39-question survey asking about self-reported oral health and physical health outcomes. And so from that, just over 2,000 respondents, about 152 were from a rural area. We recognize that that is a relatively small sample. However, just given the proportion of and the ability to capture rural data, we felt like it was really important to put together this report and highlight the sample of rural veterans. And so from there, I want to turn it over to Chelsea to walk us through the results of that report.
Thanks, Annalise. So as Annalise said, the results from the 2021 Veteran Oral Health Survey allowed us to explore some areas regarding rural veterans. So we found 3 key areas to focus on. So the first area I'll touch on is access to dental care for rural veterans. Next slide, please. So as you can see by the percentages included on this slide, survey results reveal that rural veterans struggle with accessing dental care at a higher rate than non-rural veterans. 35% of rural veterans rated their dental health as poor compared to 28% of urban veterans. Rural veterans didn't rank their mental or physical health in the same way, which indicates they are very aware of the true state of their dental health. 6% of rural veterans visited an ED for a dental issue compared to 5.8% of urban veterans. And 72% of rural veterans were seen in a private practice dental setting compared to 64% of urban veterans. This may be attributed to the fact that urban veterans have more dental access options outside of private practices. And then lastly on this slide, 49% of rural veterans did not qualify for dental care through the VA compared to 29% of urban veterans. Next slide, please. So a few key takeaways in terms of access to care. So the first one being rural veterans are less likely to access their dental care in the VA health system due to lack of eligibility. And even if this is true, even if they access other medical care within the VA. And then secondly, rural veterans lack consistent and effective dental insurance coverage. This can be seen through the large percentage of rural veterans that indicated other when asked about their dental insurance, and also the spread across employer-sponsored plans, private, TRICARE, and VA insurance options. And then the lack of access to affordable routine dental care may be driving increased emergency department visits, which was at 6% on the last slide. And then lastly, rural veterans are aware that their limited access to dental care affects their oral health, and it is why more rural veterans rated their oral health as poor. Next slide, please. So the next area we can take a look at is the rural veteran health outcomes. Next slide, please. So respondents were provided 8 oral health indicators, including bleeding gums, cavities, broken or cracked teeth, etc. And 91% of rural veterans disclosed one or more of those negative oral health indicators. 40% of rural veterans reported needing or having dentures. This is substantially more than urban veterans who were at 23%. 62% of rural veterans struggled with the function of their mouth or teeth, indicating on the survey that they struggled sometimes or half the time. This is noticeably more than the 52% of the urban veterans who indicated the same. And then 66% of rural veterans reported at least one of the 7 provided negative physical health conditions that are connected to poor oral health. These conditions include heart disease, PTSD, diabetes, and more. These results are also supported by Burfess findings of increased diabetes and heart disease in rural veterans. Next slide, please. So the 2021 survey results supported the fact that although rural and urban veterans report similar frequencies of dental visits, rural veterans experienced a higher number of negative oral health indicators and poor oral health outcomes than urban veterans. Rural veterans also understand the impact of negative oral health indicators and seem to recognize that they will have poorer oral health outcomes as a result. And then lastly, rural veterans have a higher prevalence of chronic diseases that exacerbate poor oral health. These conditions, along with inadequate access to dental care, likely contribute to poorer oral health outcomes in rural veterans. Next slide, please. And the last area that we'll touch on is cost of care. Next slide. So as you can see on this chart, rural veterans indicated higher out-of-pocket costs for dental care than urban veterans. So rural veterans are represented on the left column, urban on the right. The dark blue indicates those that paid $500 to $999 annually in dental care. So 26.5% of rural veterans indicated this amount in out-of-pocket costs compared to 22.1% of urban veterans. We also saw a higher percentage of rural veterans paying over $3,000 annually at 4.4% compared to the urban veterans at 3.1%. Next slide, please. So the key takeaways from the cost of care results include, on average, rural veterans are paying higher out-of-pocket costs for dental care compared with urban veterans. And then it's important to note that fewer rural veterans are accessing dental care, and there is a significant lack of data making additional cost trends difficult to evaluate. So as you can see from these three areas, there are a lot of inequities that rural veterans face, and I feel like our report really does focus and hone in on those. But like I said, if you read the report, it'll cover everything, but these were like some of the highlights that we could include for those areas. Next slide, please. And I'll turn it over to Annalise.
Thanks, Chelsea. So as Chelsea mentioned, our goal was to highlight some of these key areas. And also by highlighting these key areas, we want to point out some ways to improve the oral health of rural veterans based on our data and also just the body of work that we've been, kind of gone through over the past year plus. Next slide. So first recommendation is related to policy change. First and foremost, we have been big proponents of saying that eligibility through the VA to cover dental care should be expanded. We didn't say this in the beginning, and that's my fault. I probably should have said it at the very beginning. 85% of veterans do not qualify for dental care through the VA. That is a major barrier to both accessing care and covering care. And so we also know, as Chelsea just pointed out, that many rural veterans are accessing medical care through VA facilities. In fact, more veterans in rural areas are accessing VA facilities compared to urban veterans. They're just not eligible for dental care. So first and foremost, we are big proponents of expanding eligibility through the VA to receive and cover dental care. And that is a recommendation that will help all veterans. Next, one of our recommendations kind of in conjunction with that is strengthening the community care program. That is the ability for veterans to be able to receive care outside of the VA. And we believe that that is another policy option for folks to consider. Third, again, a recommendation that probably helps all people, all veterans, and anybody who has a mouth is to prioritize a value-based funding model, meaning that financially, that providers are reinforced to financially incentivized to provide the best care and keep people healthy versus a fee-for-service model, which is predominant in oral health and the dental industry. Next slide. Data collection, as we acknowledged in the beginning, this is a small sample size, although we do believe it is a robust sample of the 2,000 plus. It's very difficult to get data on rural communities for a variety of reasons. we have engaged in a community research model wherein we partner in very dedicated ways with veteran service organizations that allows us to access some of these rural communities better. But there's just an acknowledgement here that there's not enough data that exists in rural communities, and we should all do a better job collecting it and doing outreach within those communities. Lastly, recommendations for care delivery include leveraging telehealth opportunities to connect with veterans. We always preface that by saying we understand there are limitations that exist in rural areas as it relates to broadband access and being able to effectively leverage telehealth. So that also is coupled with saying expand broadband access in rural areas, which would help everybody with access to telehealth. But this is one tool that can be used to improve care delivery. And then next, we kind of call for providers practicing at the top of their scope. This is a recommendation that we made in our original report too, released in December of 2021. We believe that improving access to care means that every clinician is practicing at the top of their licensure and can really be an effective part of the care team. Lastly, we recommend that wraparound services should be included as part of standard care planning. That means that transportation needs should be considered, childcare needs should be considered, because a lot of rural veterans experience these logistical barriers to accessing care. And so to be able to support that, care providers need to include those resources if available in treatment planning. And our last slide is to just point out that we've actually made all of this data available in an interactive format via our dashboard. AIDPH and CareQuest created this dashboard earlier this year, and we have a lot of data that's both state-based, and then we have some cost data that's on veterans, and now we recently released all of this data here so that you can go through it yourself and see what kind of insights you may gather about rural veterans, and we encourage you to use that dashboard, and it's linked in the chat. And I believe that's the end for us.
Thank you, Annalise and Chelsea, and we have a lot of questions. So starting off, we have a question from Kristen Hofer. How does oral health affect PTSD?
So that's a really interesting question. And my response is we probably don't know the entire ramifications and effects just yet because there isn't enough research being done. Although we do know that there are connections based on some proxy and preliminary understanding. And one, there's an overarching mental health connection, right? So we know people who struggle with mental health may have lower executive functioning, and tasks like just self-care and oral health care could be challenging. Two, I want to bring up trauma-informed care approaches, which again, AIDPH and CareQuest have been big proponents of in our research, is saying that clinicians should be treating veterans with a trauma-informed approach. And I guess the third connection here is some of that developing research around inflammatory mediators and how that may exacerbate conditions like PTSD and Alzheimer's, especially when we're talking about chronic disease conditions like diabetes and heart disease. So there's a lot of different areas that we found could overlap and does overlap, but I also preface that to say we need more information in that area.
Thanks, Annalise. Wendy Smith asks, we're the only agency within our 2-county district that provides a sliding fee scale for the uninsured. How do we reach the vets to promote this option to them?
I can start off, and Chelsea, if you want to dive in, you can too. I wish I had a magic bullet to provide opportunities to all uninsured vets. The reality is many veterans are struggling to access care and to cover the cost of their care. A couple of programs that we like to bring up, one program in particular that we like to bring up that we found a lot of veterans don't know about is the VA dental insurance program. It was created under the Mission Act of 2018 and recently reauthorized. And it is essentially a private insurance program that has lower premiums that veterans can take advantage of, and many aren't aware that it exists. So I think that's one thing to highlight, along with existing care networks like FQHCs. We also really want to highlight the work of our nonprofit partners like Dental Lifeline Network, like Everyone for Veterans, who really work to stand in those care gaps and provide care coverage and care delivery services when they can to veterans who can't afford care.
And then I'll just piggyback off of that. You know, connecting with any veteran organizations that are directly in your area to give them those options to be seen within your practices. So I know like US Vets works with a lot of homeless vets that's a very hard population to reach. If you have an American Legion that is local, they'd be more than willing to share the opportunity of the sliding fee scale dental coverage at your practice.
Great advice. We have some clarifying questions about veterans' lack of eligibility for dental benefits. So what is the eligibility and who determines? So why are most veterans not, why do most veterans not qualify?
That's a great question, Stacy. So there are two pieces to why veterans don't have dental care through the VA. One is that eligibility requirement, and that is set by Congress. It's part of the federal code to say who is allowed to receive benefits from the VA and what those benefits look like, what they cost, et cetera. So it really requires passing legislation through Congress to be able to change that eligibility. The second piece or hurdle to expanding care is that we have to pay for it through the federal budget. And so once we pass legislation that amends the federal code, we also have to ensure that Congress has allocated money toward that effort to cover care. Right now, to give you some context, the VA dentistry budget is about $2.6 billion. And my understanding of where we would need to be for, all of those veterans who qualify for medical care to receive dental care, it's going to be several $1 billion more that we would need, almost 10, to be able to cover fully that cost.
Thank you. Christine asked, do you have a best practice document for data collection in rural areas? And I see that Anna posted a link to some of our data resources on the AIDPH website. Chelsea or Annalise, is there anything else you'd want to add to that?
But it's a great idea. It doesn't exist, but Chelsea and I love good ideas. Keep them coming.
And I want to thank Sarah Sherman, who is our case presenter today, for adding some additional insights around oral health and PTSD in the chat. So I encourage you to take a look there. Other questions for our presenters today? I was wondering as I was reading the report, Annalise and Chelsea, that it does such a great job at comparing what we're seeing for rural veterans versus urban veterans or non-rural veterans. I wondered, is there any data available that compares these various measures for folks in rural areas who are veterans versus non-veterans? How does that differ? Have you looked at that?
I'll jump in, and then Chelsea, if you want to chime in too. That's a great question. These data are limited to just veterans. We just surveyed veterans last year. We did, AIDPH released a report in August of this year, and you can find it on our website, where we looked at BRFIS data, Behavioral Risk Factor Surveillance System data, and we did look at rural versus non-rural veterans. We also looked at veterans versus non-veterans in rural areas. And so that was a pretty comprehensive analysis. And we would encourage folks to look at that if that's of interest too. It's a little more limited. BRFIS has fewer indicators to look at, but we were able to make that comparison with the larger data set.
Great.
Chelsea, I don't know if there's anything else you wanted to add.
No, you kind of stepped in. I was struggling to get off mute there. But I was going to say our survey was just veterans, and we really wanted to focus on getting their point of view because there wasn't a lot of data sources where we could get that but there are existing sources that we've used for like the data dashboard and other reports that do have veteran versus non-veteran.
Great. Kristen, I see you have your hand raised. Would you like to take yourself off mute?
Hi, thank you. Yes, Kristen, I'm in upstate New York. I just had a question about this, about Congress. You said that they need new legislation to get more veterans to qualify. I'm a veteran myself, and I'm just curious, are there any lobbyists or anybody trying to get this changed?
Well, first, Kristen, thank you for your service and thank you for the question. Chelsea and I have actually been working on this issue for quite a while, not lobbying, but educating members of Congress on what the research indicates and how we can support eligibility and what that would look like. Chelsea, I don't know if you want to talk about some of the cost savings that we've been able to present as part of that education effort.
Yeah, so I'm not great with numbers. The data is, but what we included with our report, I think it was like 7.5. Am I going in the right direction? At least I see you shaking your head. 7.5 billion billion in savings, and that's because of reduced ED visits and treating other overall health problems such as heart disease and diabetes. So we did see some cost savings with those numbers.
Great, thanks. A few other questions in the chat. The state of Massachusetts has Chapter 116 benefits for vets, including dental, and Christine is wondering if other states have this as well. So that feels like a place. Maybe if folks want to reply in the chat. I see Laura McKean replied with what's offered in Oregon. And Kathy's asked, regarding the federal budget and eligibility, is there opportunity for veterans to contribute to a program for their oral health?
So is that veterans to contribute financially in like a health savings space, or maybe there's a clarifying question there? Or Chelsea, did you have a response?
No, I was just thinking that the only thing that came to mind was the VADIP programs that you mentioned. So that would be something that they pay the premium, but they can enroll in, but a veteran would still have to have a medical disability to enroll in that program.
So this is Kathy, just maybe to clarify as well. I was just thinking, how we contribute to Medicare. If the federal budget is if the Congress is saying we don't have the money, we're going to have to triple this, why aren't we trying to, encourage veterans and their families to contribute to this along the way so that they don't have to bear the burden of not getting any care? Something's better than nothing. So I just wondered if there was any opportunity, or if anyone's even explored that with Congress, that they could set up a program or something similar to, how we contribute to our Medicare.
Yeah, Kathy, it's an interesting concept. And I believe at least one version of a bill perhaps explored that option in terms of reduced cost savings. No bills so far have passed either with that in mind, with full eligibility expansion, or even partial incremental expansion. So it's a really interesting concept. I believe it was included in one, bill version that I saw. So it's, I guess, something that's being explored. I don't know in earnest, but it is something that's being discussed.
Okay, thank you.
Okay, I'm going to call in Christine, and then we're going to move into our case presenter.
Hi, can you hear me all?
Yes.
Yeah. Hi, I'm the one from Massachusetts that put the question in the chat about the 116 benefits. So just curious if there's other states out there that do something similar where the veteran is paying what would be the Medicaid reimbursement rate is being reimbursed to the dental office by the veteran service officer. Would it be worth looking at either satisfaction of those veterans with their dental service? Would it be worth looking at, I don't know, health outcomes of those veterans? If there's other states, I don't know. I'm just throwing ideas out there about an area that, we're already in Massachusetts. Some of the veterans are eligible for this Chapter 116 benefit and are accessing dental care.
So I know Laura put in the chat that Oregon has a dental benefit for veterans. I know some other states like Iowa have tackled this issue in a really innovative way. Like Iowa has a trust fund for veterans to receive care. Oh, there we go. Carol beat it. Carol beat me to it. So I think some states are exploring this. I don't have the answer as to what the outcomes are of those programs. I would love to learn more if we want to keep that going in the chat or even connect after.
Great, thanks, Annalise. Christine, thanks for bringing that to the group. Yeah, I want to encourage folks, continue offering if there are things going on in your state that you're willing to share in the chat, please feel free to go ahead doing so. And thank you again to our presenters for that terrific discussion, and for all of you for being so engaged with great questions. We're now going to move on to the case presentation part of today's call. Our presenter, who I mentioned earlier, is Sarah Sherman, who is Director of Strategic Partnerships with the Maine Bureau of Veterans Services. Sarah, tell us what your case is.
Good afternoon, everyone. I'm here in Augusta, Maine, and it's sort of a unique issue. I wrote a needs assessment back in 2020, and of all the things I tried to solve, this is the one thing that has stumped me. In Maine, we have 5 Native American communities, and 4 of the 5 have dental clinics. They are located in very rural areas of the state. And currently, some are lacking dentists or operating part-time only with a hygienist. And due to the loss of a dentist in Washington County, some of the veterans are traveling up to 2 hours to seek dental care in another community. With the cost of gas, Maine, we've got snow on the horizon. This can be dangerous. And I had offered initially, back when we started the Maine Veterans Dental Network, grant money to the clinics, but they could not accept it because they are overseen by the Indian Health Service. And I am looking for a creative way to take care of the community's veterans. Native American communities across our nation have one of the highest rates of service, and I would like to help them out. And I've been working with these communities for over 4 years now, and I've developed quite a good friendship and partnership with them. So my asks of the group are what are some strategies we could use to attract new dentists to rural areas, the most rural areas of our state. For instance, in one case, between the Micmac and the Maliseet tribes, there's a 1-hour drive. Each community has a dental clinic. Could we find a dentist who would be willing to split their time between the two? How do I get the state of Maine to see the value in attracting new dental providers by increasing their loan forgiveness programs? Are there other programs I'm not aware of that could be coupled with the current one? And if a working solution evolves out of this process, how do I present the idea to the Wabanaki communities in a way that's both informative and respectful to their existing programs? Currently, I'm trying to learn about strategies in other states and communities to increase access to oral health care and outline potential solutions. Increased knowledge about the dental landscape of Maine. We're very populated in the southern part of the state and less so in northern Maine. I'm participating in the Maine Oral Health Workforce Committee, which was recently formed. We actually have our next meeting on Friday. And I work with Wabanaki Public Health and Wellness, would like to continue to work with them to find a solution that best serves the veterans in their communities. Thank you. I think that's my last slide.
Thank you, Sarah. So are there any clarifying questions for Sarah? So Bill asked in the chat, can you sublease the Native American clinics?
That would be a question for Wabanaki Public Health and Wellness. I don't know.
Okay, well, we're going to go into breakout rooms right now, where we're going to do some brainstorming around Sarah's questions and see what folks, oh, Bill says that's been done before. Thank you for that. And we will, Sarah, as I think we've shared with you after today's call, we'll be compiling all of the wisdom from this think tank to share back with you, and also to post with everyone on the call today and to share on our website with some suggested strategies for you. So we're going to be in the breakout rooms for 10 minutes. And then we will come back and ask folks to share out some notable suggestions that were made in their group. So we'll ask everyone, when you get to your room, please turn your camera on if possible. And we will see you again shortly. And some people, I should have said this, will not be seeing an invitation to a breakout room because you'll just stay here with me. This is one of our rooms. So I think we're just about there. And we are lucky to have Sarah in our room, so she can answer any additional questions that folks have. So if you're able to turn your camera on, I'm getting a little dizzy from people popping in and out, but if you're able to turn your camera on, that would be great. So all of the questions are posted in the chat that Sarah shared with us. And I will start off, let's start off with the first one. What are some strategies for attracting new dentists to rural areas in Maine? And I see that we have Judy here with us, who I know is very active in this work in Maine. So no, she's shaking her head no. You know, you're on mute, Judy. I think she's pretending because I just put her on the spot. So let me open it up to others. Thoughts on attracting new dentists to rural areas in Maine?
Judy, do you happen to have your do you have earbuds that might be plugged in? Because I've done that in meetings. I start talking, but I don't have my earbuds in. Okay.
Or I wonder if folks on the line have thoughts thinking about their own states, if you're aware of strategies that have worked in your states to attract dentists to rural areas, or in other states that you're aware of.
I think this is Sonia. I think we could improve or reimbursement rates or give some kind of stimulus, or for example, loan forgiveness for new graduate students, to encourage them to put their practices in rural areas. I understand that this is very challenging because rural areas have small populations. So I don't know whether it would be a good idea, you know, for dentists to run a practice where, for example, there are populations of about 250 people per city, small cities, or 1,000 people. So, but I think improving those stimulus will be a good strategy. Thank you.
Thank you. And I see one of Sarah's follow-up questions is, how do I get the state of Maine to see the value in attracting new dental providers by increasing their loan forgiveness programs? Do you have any additional thoughts on that, Sonia? Or others?
I
And
think
Jody,
forgiveness, excuse me.
go ahead.
Um, um, Increasing reimbursement rates or expanding forgiveness programs will be a good practice. And I am from Colombia, and I was dentist there for 26 years, and we had a practice there. And that was that when we graduated, we had to get our license. We had to go to a rural area to provide services. So I think, I don't know, this will require a lot of policy, I will say, but I think that is a good strategy to bring dentists to rural areas, make that like a requirement to get a license. That was a practice in my country, and that was certainly useful for underserved communities.
Thank you. Valerie.
Hi, I can't really add to that topic, but I'm curious because I understand that a lot of, and I guess I'm not going to say it correctly. Forgive me, but I know that a lot of, are they tribes that are sovereign nations, or is it like a sovereign nation that can have multiple tribes? But I know that they govern themselves, and that can be very separate from our tax-paying U.S. government. What I'm wondering is, has anybody ever considered offering free education or discounted education or payback for Native American students who go to dental school, so they can go to school at a discounted rate for free and then come back and serve in their tribe? Then we're educating them. We could do hygienists, assistants, dentists, train them and have them serve themselves. That brings income into their community. I don't know if it's possible or how that would even look like, but to me, it feels like a win-win.
Thank you. Nicole.
Hi, so I apologize, this may be a little bit kind of at the beginning compared to what Valerie talked about, but I think that's a wonderful suggestion of being able to recruit from the community for them to return to the community from which they came from. Regarding the just staffing and dental shortages, Pennsylvania without doubt is also experiencing the same thing. And one thing that has been thrown around and discussed as far as a possibility of trying to formalize a plan with is really looking at our current workforce. So the way Pennsylvania geographically is set up, the 4 dental schools that we have where we can produce dentists are located primarily on the outskirts of the state where the border is. And there's really nothing covering that central or northeastern part of the state. So an idea, I'm not sure what it would look like in Maine, Sarah, is trying to recognize maybe some of the dentists that are retiring or wanting to retire or slow their practice down, seeing if they would be willing to go into those rural areas for a few days a week instead of entering retirement fully, because we know our recent dental grads, they want to stay in the more urban areas, enjoy all of the things that go along with urban living, where maybe a retiring dentist is more apt to enjoy some of the slower pace of a rural lifestyle. So I don't know if that's a possible option or something to explore with your communities.
Thank you. And I want to flag Sarah's last question as well. If a working solution evolves out of this process, how do I present the idea to the Wabanaki communities in a way that is both informative and respectful to their existing programs? Judy.
I just changed mics. Can you hear me now?
Yes.
Yeah, I forgot to test the audio. You're lucky you didn't just hear squeaks, because that's usually what
I've
happens.
heard you do that before.
Yeah, I know. I don't get it. Sarah, to what extent are you, I mean, the only thing I can think of, and it's not news to anybody, is make sure that they're working with you, with the rest of us from day one, or even before day one. And you already, you know, when you did the needs assessment, you made some good connections there. That's just go back and be persistent. And with all respect to everybody, and Stacy, you asked for this. You know, I've been looking at this for over 30 years, maybe more, and we're a little bit closer, but it's a really hard place to be. Those where those clinics are located, they are the end of the road. You know, a lot of places they really are the end of the road. The road ends just beyond at the back door to the area. So it's just a real challenge. They are hard places to live. And when somebody comes in with a ton of debt, the loan repayment programs, which some of which are taxable, there are so many changes that have to be made. There's no magic bullet, and it's going to be a long-term solution. And that's what makes me want to pull out the rest of my hair. And I feel, you know, Sarah and I've been working together since she started that report. So, and I just think, sometimes I think it's like it's like a Rubik's Cube or something, and everything is lined up, but you got to look at it a different way. And we haven't found that yet.
Well, Judy, I'm glad you found your literal voice, and appreciate that last comment. Welcome back, everyone. Usually on these calls, people come back from the breakout rooms a little early. I know in our room, conversation was right up until the wire. So it sounds like it was like that across the rooms, and that we're going to have a really rich set of recommendations for you, Sarah. I wonder if anyone would like to share some recommendations that came out of the room they were in. How about in Annalise's room?
I'm happy to provide a couple of points, and then folks can jump in as they'd like to. I know we talked a lot about how to leverage the existing network, and maybe even recruiting from the Public Health Service Corps. I know the loan repayment options are certainly a consideration. I know Bill had some networks that he's built in Michigan that leverage dental schools and also kind of clinicians and networks around that in those rural areas. And while I have the attention of the group too, I'm going to put something into the chat, which is AIDPH and the National Network for Oral Health Access are collecting best practice submissions for veteran oral health care, and Sarah is on our work group. So I heard a lot of really great ideas in my room. I'm sure you guys did too, and we want to ensure that we're capturing all of those really good ideas so that everyone can benefit from your wonderful programs. So we had a lot of great discussion. If anybody else wants to add to it, please do. But I wanted to just kind of put it out there too, that we won't just capture it here in the session. We'd love to capture it formally as part of our best practice work group.
Thanks, Annalise. How about one or two ideas that came out of Caroline's room?
Share. We actually had Beth Pierce and Kate Christensen, I hope I've gotten your names correct, who are residents of Maine and working in Maine in this space, and they let us know that another loan repayment program was just created in Maine, so they're going to get in touch with information about that, so that was fantastic. And then we discussion on if there were any opportunities to attract other maybe cheaper providers with potentially less debt to these areas like dental therapists or dental hygienists, who were just discussing the landscape for that in Maine. And then we didn't get enough time to talk through this. And honestly, we could probably talk about this all day, but we started to talk about solutions and wanting to address the underlying problem of increasing student loans and really working with the dental schools and universities, knowing this is a much bigger problem, but to try and cost contain student debt so it doesn't continue to skyrocket. That really limits what students can do after they get out of school, instead of just working downstream, trying to work upstream with the debt issue. But anything else that anyone wants to add would be great too.
How about one idea that came out of my room?
So one of the ones we had was to recruit students to enter the dental workforce from rural communities and encourage them to go back to the rural communities to practice. And another one was look at the current workforce as well and recognize dentists who are retiring in rural communities and try to encourage them to at least work at a part-time basis or maybe volunteer basis even though they're planning to retire, if they're willing to do that.
Great, thanks, Jasmine. And thanks to everyone for the thoughtful suggestions that came up. As I said, we had a great conversation in our room. So thank you, everyone. I'm going to ask Jasmine to call the slides back up. And as she's doing that, so I'll just mention, this is the last call in this year's AIDPH Rural Oral Health Echo series. We're going to be starting up again in February, so be on the lookout for an announcement about that. You still have an opportunity to earn a certificate in special topics in rural oral health, and by going to our website. And you'll also receive the evaluation and request form following today's call for CEUs. I believe you need to complete 8 of these to earn the certificate. Yes, Jasmine? I always forget that number. It's 8. And I think that's all. Anything I'm forgetting? I just want to acknowledge and thank everyone for showing up over the course of this whole year throughout this series. As I mentioned, we're going to be starting up again in February, really based on the energy and support we've gotten from folks who have come to these calls month after month, brought their ideas, brought their positive energy. I even think cameras are on more than they used to be. So maybe folks are feeling more comfortable in that space with us here. So we thank you for that. We wish you all a happy holiday season, a happy and healthy new year, and look forward to seeing you again on this platform in 2023. Thanks, everyone. Bye-bye.